Here I am today at Dr. Paul Darmone's office, and Dr. Paul Darmone is my dentist, but also my dear friend, and he was nice enough to talk to us about dental health today. I know there's a lot of fears and a lot of issues with people about going to the dentist. So here I am with Dr. Paul, and we're going to talk about some issues that I think that people have. So one of the questions I wanted to ask you is, what is the relationship between overall health and dental health?
Well, there's definitely a relationship between overall health and dental health. And if you want to grow up to be 80, 90, 100 years old, part of your overall health plan should be to maintain your oral health. In fact, one of the common denominators my 90-year-old healthy patients have is that they all have their own teeth. So we know now that inflammation is a bad thing. Everybody understands the implication of inflammation. And periodontal disease, which is the leading cause of tooth loss in adults, is an inflammatory disease. And it's linked to heart attack and stroke, cardiovascular disease, arthritis, Alzheimer's disease, diabetes, even some kinds of cancer now, low birth weight babies. So there's a big implication there, and that's why we strive in our office to make sure that we take care of the inflammation in people's mouths.
Awesome. Can we talk a little bit more about inflammation and heart disease and how there's that common link?
Sure. Well, the inflammation of a person's mouth is caused by mostly bacterial plaque that people accumulate. That's bacteria. And the bacteria creates what we call a bioburden in the body. It's a series of different bacteria. And some of these bacteria are tissue invasive. In other words, they get into the bloodstream and they travel to other parts of your body. And it's been found that some of these bacteria actually are found in the lining of the arteries, which make it more susceptible to plaque release from the arteries, to heart attack and stroke. And that's one of the ways it does it.
Okay, so does the tooth loss also have to deal with that, with the inflammation? So the more inflammatory your gums are, the more likely you are to lose teeth?
Sure. The more inflammatory your gums are, the more likely you are to lose bone around your teeth. It's like a fence post. If you have a fence post deep into the ground, it's pretty stable. But as the ground moves away from that fence post and the fence post comes out of the ground, the teeth eventually become loose and you lose your teeth. So it's the same reason. Typically, we recommend a power toothbrush. Power toothbrushes like a Sonicare Oral-B. Power toothbrushes have been proven to clean about 40% better than a hand toothbrush. In our practice, I've seen it clinically where we've seen big improvement when somebody switches to a power toothbrush.
Okay, so that's great information and you can get power toothbrushes anywhere. You can get them obviously from your dentist, or you can go to pretty much any local store and get them.
Yep.
So that's amazing. There's a big link, I know, with oral health and hygiene and smoking, and I know that there's cancers that can be caused, and we obviously know the cancers that are caused in the body, from smoking. But how about oral cancers that can happen? Is that because of smoking?
But smoking certainly increases the risk of oral cancer. Not only smoking, but chewing tobacco does too, anything. And also frequent or abusive alcohol consumption can also increase the risk of oral cancer. Believe it or not, sun exposure can increase the risk of oral cancer on the lower lip, when people get their lower lip sunburned.
That makes sense. Yeah. So how do you detect oral cancer?
In our practice, we do a complete oral cancer exam that's recommended by the World Health Organization. If you'd like, we can kind of go through.
Absolutely, let's do it.
Want to do that? Okay. So let me get my. So one of the things to make sure that we're preventing oral cancer is to have a thorough dental and oral cancer exam every time you see your dentist. And every dentist should be doing this at their examination. So I've got Sarah here, and we're going to go through an oral cancer exam. So in my office, I always start out on the outside, and we check for lymph nodes, because lymph nodes could be a sign of disease. So we just feel under the chin, and I'm looking for lumps and bumps.
And I'm really ticklish.
And she's really ticklish, so sometimes it's hard on ticklish people. And then we go down the throat here. And I'm just looking for lumps and bumps and anything unusual, anything tender, and I'm going to ask her to swallow. Go ahead and swallow. We're going to look on both sides of the tongue. The tongue is the lateral borders of the tongue, and the sides of the tongue are a typical place where you might find oral cancer or lesions. And now I'm going to look what we call the floor of the mouth. So I'm going to move her tongue to one side. I'm going to look on one side, and that looks normal. And I'm going to look on the other side. And that looks normal. And it's not just visual, but we want to feel too. So I'm going to put my finger down there and look, and feel from both sides, the outside and the inside, to see if there's any lumps or bumps. And that feels good. And that feels good. Okay, that looks all normal. Now we're going to have Sarah turn toward me. I'm going to say ah.
Ah.
When she says ah, it lifts up her soft palate so I can look right down her throat and at her tonsils and at her oral pharynx, and that looks good and normal. And I'm going to look at her hard palate, and that looks good. I'm going to look behind her teeth up there, and that looks good. I'm going to look at the soft palate, and that looks good. We're going to look at the ridges around the teeth. And these are all areas where disease can manifest and show up. And oral cancer can manifest itself as swellings, bumps, red lesions, white lesions, spontaneous bleeding. Right together. And we want to look at the lips. And we want to feel that as well. And that looks good. And then I want to look at the cheeks too. Now in the cheeks we have the parotid gland, which is a salivary gland. And tumors can appear in the parotid gland, so it's very important to feel that gland and make sure that everything is okay on one side, and we're going to look on the other side. And that looks all good. And Sarah looks fine.